video provides a more detailed description of how community information integration and the Central Patient Attachment Registry work. Community information integration, also known as CII, connects community clinic EMRs to Netcare and CPAR, which is the Central Patient Attachment Registry. This is how it works for individual providers using a conformed EMR that signed up to participate. On the left, you can see that 3 types of information, encounters, consult reports, and patient panels, can move through the CII Data Hub to Alberta Netcare, CPAR, and the Healthcare Data Repository. Information also goes back to the clinic EMR in the form of electronic notifications, which are called e-notifications. The Provincial Client Registry validates patient identity. This slide is busy, so let's break it down. Again, 3 types of information that are shared from participating clinics are encounters, panels, and consult reports. Let's start with encounters. Any provider can sign up for CII to submit encounters or basic visit information. Select information is mapped from EMRs and forms a Community Encounter Digest or CED for each patient in Alberta Netcare. Individual data elements also go to the Healthcare Data Repository, where it will be used for population health and quality improvement. The data is governed by the Provincial Health Information Data Governance Committee. The Community Encounter Digest, or CED, sits in the Community Reports folder in Netcare and is a rolling snapshot of care. It tells a story of where a patient has received care in any CII-enabled clinic. It informs decision-making amongst the patient's providers. The individual data elements that make up the CED were recommended by the Canadian Institute for Health Information and indicate when, where, who saw the patient, the reason the patient booked the encounter, and the provider assessment. Any new information documented in a designated map field gets shared, including a new problem or profile item, possible allergies, vitals, an immunization, and if a new referral was initiated. Before going live, participants are trained on what maps from their EMR and how to keep information from flowing to the CED. The second type of information is panels. Once a primary provider in a community clinic signs up and is set up, once a month a list of their paneled patients are automatically sent through the CII Data Hub to CPAR. Patient identities are validated, and now the CII Data Hub can communicate to the system which patient has an established care relationship with which primary provider. This also informs Alberta Netcare. At the clinic, a team member can log into the secure CPAR portal and download reports about the panel, such as demographic mismatches, including deceased patients, or panel attachment conflicts, as CPAR does a monthly sorting of the information, looking for cross matches to identify patients on more than one panel in Alberta. This informs relational continuity of care. What's new in 2022 is that the name of the CPAR primary provider displays in the patient's content banner in Alberta Netcare. In addition to the provider name, it displays their specialty area, such as family medicine or pediatrics, as well as the name of the clinic and the city or town where it's located. If the patient has said yes to being paneled at more than one clinic, each provider is displayed. If the patient's primary provider is not yet participating in CPAR, it indicates no CPAR primary provider. So now that Alberta's health system through CII knows the relationships between patients and their primary providers, messaging can support continuity of care. When that patient is admitted or discharged from hospital or discharged from an emergency department or day surgery, the AHS Admission Discharge Transfer System informs CII, and twice a day at 6 a.m. and 2 p.m., messages are ready to be picked up by the community EMRs. Now, primary providers in the community can have timely notice of these events for their paneled patients. The workflow is integrated into the EMR, similar to lab results. Here's an example of what a provider would see in their clinic EMR. They can see the AHS facility and when the patient was admitted or discharged, and the admitting provider and reason, if it's available. Notices from AHS facilities enabled on Netcare also show if the patient is deceased. On average, participants receive about 2 notices a day. Participating primary providers indicate that the follow-up they offer supports better transitions of care and prevents rehospitalizations. The notice becomes part of the patient's chart. And now, consult reports. Finally, any provider that receives referrals and writes consult report letters can participate and choose to send a copy to Alberta Netcare as a PDF document. It can be as simple as a click. Consults from the community are available in the Consultations folder in Netcare, labeled to indicate the specialty of the provider who submitted, and are available to others in the system. Both the consult reports and the community encounters are informing decisions in emergency departments and hospitals. While community information integration and the Central Patient Attachment Registry have future enhancements in the works, in its current state it is benefiting Albertans, physicians, other providers, as well as the health system. Patients have less storytelling and improved continuity of care. Providers have access to information that was previously held only in clinic EMRs. Primary providers receive e-notifications for smoother transitions of care. The system also has improved data for quality improvement purposes. If you're a family physician, tell your primary care network you are interested. If you're not a member of a PCN, you can email continuity@albertadoctors.org. Specialty providers interested in submitting consult reports directly from their EMR to Alberta Netcare can email cii-specialty@albertadoctors.org.